Hello, the purpose of this presentation is to discuss the benefits for you as the patient in a facility with electronic health record EHR implementation. Before we discuss the patient benefits, it is best to understand the definition of an electronic health record. An electronic health record is a version of the patient's health information that can be accessed by other medical providers served within that system. It may include, but is not limited to, patient demographics such as name, date of birth, social security number, medication lists, lab results, and medical history. It can also include patient allergies and surgical history, and previous visits from other physicians and their progress notes. As more and more facilities are moving towards EHR implementation, it is good to know the benefits that the patients receive, such as decreased medical errors, decreased hospital costs, and increased involvement in care. Let us begin by first discussing decreased medical errors. As medical providers input prescription or medication orders in an electronic system, the system has the ability to alert for any potential adverse reactions from any of the current medications that's on the patient's medication list. It can also alert the provider for any patient allergies. Additionally, it eliminates wrong interpretation of medical provider handwriting. Research shows that prescription pads and illegible handwriting can lead to medical errors due to wrong dose or wrong medication. It is also important that the medication list on file is updated at every visit so that it remains current and the patient is not taking any medication that they do not need to be on. Another patient benefit of EHR implementation is a decrease in hospital costs. Electronic health records provide medical providers information on labs and imaging that was performed and ordered by other physicians and other facilities. In a true comprehensive patient care, physicians are able to view progress notes from other providers and have a clear picture of what treatments were performed and what treatments are still necessary. Additionally, knowing this information can eliminate duplicate orders and reduce inappropriate hospital admissions caused by errors. Lastly, we will discuss the patient benefit of increased involvement in care. Electronic health records provides opportunity for patients to be more informed and active in their own treatment. In facilities with EHR implementation, some areas, such as outpatient centers, provide patient portals that allow access to health information such as lab and imaging results and future appointments. These patient portals allow patients to access their information in the comfort of their home. It also provides the opportunity for patients to communicate with their providers for any of their needs. Research have shown that patient portals have improved patient-provider relationships by increasing provider response times via the messages through the portal. Patients may be able to receive answers to their questions in a timely manner versus when waiting for a phone call. Patient portals also increase efficiency because tasks can be done with a limited amount of resources at a faster time. For example, patients are able to fill out paperwork that may be needed for an upcoming appointment prior to arriving on site. It also eliminates the need for the physicians to call with a follow-up or results because patients are able to access this information at home. While some patients are able to provide their past medical and surgical history without any difficulties, other patients are not that involved in their care and may not even know the reason why they are taking certain medications. So what does the future hold? The Centers for Medicare and Medicaid Services and the Office of the National Coordinator for Health Information Technology have released proposed rules to provide both patient and provider access to a complete health record while maintaining the privacy and security of the information. The goal is to have a comprehensive patient chart versus multiple separate charts that can leave room for error. The CMS and ONC also seek to reduce information blocking that are performed by medical providers that are attempting to keep their patients. Due to competitive times, some physicians are blocking patient information so other medical providers are not able to view them. This is one way that they're able to retain their patient. According to the Compliance Resource Group, the Centers for Medicare and Medicaid Services will begin to provide names of medical providers that are not able to provide information on how they are combating information blocking. As technology begins to start or take over the current practice, electronic health records are going to keep changing. The progress and developments will hopefully lead to a better electronic health record system that can be easily accessible to providers and patients alike. While some facilities are still slowly transitioning to an electronic health system, this will eventually become the norm for all facilities all over the world. Patients will benefit from EHR implementation through a decrease in medical errors, a decrease in hospital costs, and an increase in their own treatment or plan of care. Thank you for watching the presentation, and I hope that I was able to provide you some good information.